Chest pain. Anytime somebody has chest pain, there is always a fear if the chest pain is because of a heart attack. Today, let's take a look at what are the causes of chest pain and if you can tell if the chest pain is because of a heart attack or not. Heart attack is one of the most common causes for chest pain, and sometimes we can specifically tell if the pain is from a heart attack because heart attack produces a very typical kind of chest pain. It is usually a very intense, crushing type of pain at the center of the chest. Some people will describe it as an intense heaviness. It is so heavy that they might sometimes describe that they feel as if an elephant is standing on your chest. And this pain or heaviness can sometimes move or radiate to the neck or the jaw, to the back of your chest, as well as to the left shoulder all the way down to your hand. Along with the pain, you can experience sweating and breathing difficulty as well. This is the typical chest pain which could last up to or more than 10 to 20 minutes. But unfortunately, all those who are having a heart attack does not necessarily have this typical form of chest pain. Particularly three groups of people. One is patients with diabetes, women and elderly individuals. Most important is patients with diabetes, because diabetes is one of the most important risk factors for heart attack. In diabetic patients, because of nerve damage, they may not experience chest pain. Most commonly, they will have a very vague chest discomfort, sometimes a burning sensation like gas, or sometimes there is no pain at all. It might just be a breathing difficulty. Also in women and elderly patients, they may not experience the typical chest pain during heart attack. So this is why it is not always easy to tell from the character of the pain if the pain is because of the heart or no. And the only way to know is to obtain an ECG or an electrocardiogram, which will ascertain if the pain is from a heart attack. Particularly important in diabetic patients because they do not feel the typical chest pain, and a long-standing diabetic patient, particularly with uncontrolled sugars, if they have any kind of chest discomfort, it has to be taken seriously and an ECG obtained to make sure. We often come across diabetic patients who think that their discomfort is because of gas and they do not seek treatment, and then by the time they get to the hospital after 2 to 3 days, they have already suffered a major heart attack. This is resting pain experienced during a heart attack when your blood vessel is completely or almost completely blocked. There is another form of chest pain called angina pectoris or exertional angina. These are seen in people with partially blocked blood vessels. So they do not have any symptoms at rest. But anytime they walk or exert more than usual, they will start experiencing a chest pain or chest heaviness, which could be intense enough to make them stop what they are doing. And upon taking rest, the pain might disappear. Sometimes the pain does not disappear even at rest, and they have to take a sorbitrate medication, put it under the tongue to get relief from the pain. This is also a form of cardiac chest pain, which is called as exertional angina, experienced in people with partially blocked blood vessels. Completely blocked blood vessel is heart attack, and you will experience pain even at rest. Let's take a look at a few other common causes of chest pain and find out how we can differentiate. One other very common cause of chest pain is increased acidity in the stomach, what we describe as gas. So increased acidity can cause a burning type of chest pain, usually in the upper part of the stomach, and this can also move or radiate all the way up to the throat, and this is usually relieved by antacids. Another common cause of chest pain is a musculoskeletal pain, which usually causes a very catching sensation. It typically occurs after you have twisted yourself or sprained yourself, either the chest or the shoulder, and causes a catching type of pain, and the pain is reproducible if you reproduce the same motion which created the chest pain. So these are the two other common causes of chest pain. And there are other more causes. For example, people having respiratory infection and persistent cough. They keep on coughing, and towards the end, after every cough, they might experience a heavy chest pain. There are other causes such as a spasm of the foot tube or the esophagus can cause chest pain, and other rare causes such as aortic dissection. The main blood vessel in the heart arising from the heart could be dilated because of high blood pressure, and this blood vessel can tear, causing a severe crushing chest pain, which typically radiates all the way back to the chest. So those are other uncommon causes of chest pain that you might need to know about. So to sum up, we talked about the different causes of chest pain, the three most common being chest pain from heart conditions or heart attack or angina pectoris, chest pain because of increased acidity in the stomach, which is more of a burning chest pain, and musculoskeletal chest pain, which is of a catching type due to sprain. We also described the features of a typical chest pain during a heart attack, but unfortunately not all people will experience that, particularly in diabetics, women and elderly individuals, and the only way to confirm if the chest pain is because of a heart attack is to obtain a ECG.